I want to talk about digital twins and built-in environments in the healthcare sector, especially more in the medical use case, therefore in hospitals. I have already worked on a project combined with a hospital to develop AI software to better manage their resources. And now, with the knowledge I've earned through the lecture, I see that we could have done what we have done previously for them as a digital twin. So we have created software which predicts how long a patient is staying in the intensive care unit of a hospital. And I think you could model something like that really good as a digital twin, because you have all the information about a patient in the intensive care unit. There are measured regularly, like temperatures, blood pressures, and so on. And if you combine all the information a hospital has about a patient in the intensive care unit, you could create something like a digital person and a digital patient, which has all the information about the well-being of the patient currently. And if you have that, you can model and predict some things that could be really interesting. So you could maybe forward the stay of the patient and look how how will the stay of the patient go on. So maybe there's a crisis waiting on the patient and you could detect it with a digital twin earlier, or you can see with that kind of measurements we have currently at that digital twin, that digital person, he will be leaving the hospital in 6 hours. So I see really great use case for something like a digital patient for hospital use cases. There the improvement for the patient is there because you can better handle him, because you can look in the future of the stay and maybe detect some things that are going to happen and prevent them maybe, or you can give him accurate information. So you can plan him forward and say, with all the information we currently have and the protection of your medical status, we can discharge you in about 6 hours. And there's also the great use case for the hospital. So with the digital twin, you releasing stress of the personnel, because you can decrease emergency operations, like the status of a patient is decreasing drastically, and now the medical personnel has to react to stabilize him. With a digital twin, you can realize these situations early and prevent them, and so far release stress from the medical personnel. And also you can better plan your hospital, because with the modeling and the predictions from the digital twin, you can better manage your resources. So maybe you have 6 intensive care beds and currently 4 are occupied, but you know through the digital twin of the patient that 3 will be free in about 6 hours. Then you can plan these 3 plus the 1 bed you already have free as free in 6 hours, and that could be a really good use case and improve the management of the hospital, and generally increase really the grade of the medical system overall, because the few resources we have are managed better and more efficiently, so that the general medical service is better. I hope I could give you a brief look into the use case into a hospital, and I hope you liked it.